Good evening, everyone. Thank you for your patience. We just wanted to give folks a few minutes to log in. My name is Dr. Amy Commander, and I'm Director of Cancer Survivorship at the Mass General Cancer Center at Newton-Wellesley. Thank you so much for joining us tonight for our Survivorship webinar series entitled Thriving After Cancer, Strategies and State of Mind. June is nationally recognized as Cancer Survivor Month, and during this month, we have the opportunity for all 16.9 million cancer survivors across the country to celebrate their milestones and recognize those that supported them along the way. Cancer Survivor Month is also an opportunity for those who have not been affected by cancer to learn and understand the challenges that accompany survivorship. After this very challenging past 15 months, I'm really looking forward to tonight's talk entitled Keep Calm and Carry On, Putting Stress in Its Place. It is now my privilege to introduce our three speakers. Michelle Shields is a board-certified massage therapist at the Mass General Cancer Center at Newton-Wellesley. She has been a massage therapist for over 15 years, and she has specialized in oncology massage and Reiki for the past 8 years. When COVID cases surged last year, Michelle developed a virtual meditation program for our patients with the goal to help individuals combat loneliness and isolation. In addition, Michelle teaches professional massage therapists how to work safely with oncology patients. Our second speaker tonight is Julia Kennedy. Julia is a board-certified adult nurse practitioner specializing in palliative care at Newton-Wellesley Hospital and at the Mass General Cancer Center at Newton-Wellesley. She has led several support groups over the past 8 years, most recently a wellness group for healthcare providers. She is also certified in the SMART program, or the Stress Management and Resiliency program, which is offered through the Benson Henry Institute at MGH. She has led SMART classes for the past 3 years. Finally, Rochelle Lamaster is a licensed independent clinical social worker who has counseled and supported persons experiencing medical illness her entire career. She has worked for the past 10 years with patients receiving oncology care at Newton-Wellesley Hospital. In addition, Rochelle has led many groups, including groups focused on helping individuals with diagnoses of breast cancer and head and neck cancer, and she has also focused on a bereavement group. She has also led our stress management group for cancer patients. She counsels individuals and family members through all phases of cancer treatment. We are so fortunate to learn from these three amazing women tonight. Just to let you know, this session is being recorded. If you have a question, feel free to put it in the chat box because we'll have time for a Q&A session at the conclusion of the presentation. Thank you. I will now turn it over to Michelle Shields. Michelle, just a reminder to unmute.
Thank you. Hi, I'm Michelle Shields, and tonight our goal is to talk about how stress affects the body and some common stressors many people face during or after a cancer treatment, and then to spend some time practicing some simple exercises that may help you manage your stress levels. And I say manage, not eliminate, because we know it's impossible to completely eliminate stress. And we know the stress and worry associated with a cancer diagnosis is real and complex, and we don't want to minimize that or suggest that a simple exercise will make that go away. But we also know that when stress levels go ignored or unchecked, it can be a pretty difficult space to live in. And it can also be difficult to prioritize our health to take care of ourselves. It can be hard to find the energy and motivation for self-care. We might feel like we're not very good at it. And it can feel impossible to find the time during our busy day. So thank you for prioritizing your health and finding the time during your busy day to join us tonight. And with that time crunch in mind, our first exercise is something that takes just a few minutes. It's a quick and easy breathing exercise. You can do it anywhere, and people can begin to feel a difference even after just a few minutes of it. And it's called diaphragmatic breathing or deep belly breathing, and some of you might be familiar with it. When we're stressed or tense, our breathing often becomes shallow and more rapid and more from our chest. We tend to breathe from our chest. Over time, this can become a habit. And that means that your lungs aren't getting as much oxygenated air as possible. It can cause you to feel short of breath and even cause you to feel anxious. What we want to do instead is to breathe more from our belly, engaging our diaphragm, which is the muscle below our lungs, and taking full, deep breaths. And so if you look at this slide, this illustrates deep belly breathing. So as you can see, you slowly take a deep breath in through the nose or the mouth, filling your lungs with air. And as you do that, you're pressing down into your abdomen, and your abdomen expands or your belly moves out. So as you inhale, your belly should be moving outward. And then as we exhale or release that air, our belly contracts or moves inward. So the major ideas are, as we inhale, our belly moves out. And as we exhale slowly, our belly moves in. And when we breathe this way, it can help increase your oxygen intake, help lower your heart rate, and help make you feel more calm. So we're going to practice this for about a minute tonight. And I'm going to set a timer. And if at any point you feel lightheaded or dizzy, go ahead and just return to your natural breath. But we'll start. I'll have you place one hand on your chest and the other hand down on your belly here. And the reason we do that is we want to pay attention to which hands are moving when we breathe. If my upper hand on my chest is moving more, then I know I have that shallow breath from my chest. So I really want to feel the hand that's on my belly moving in and out as I'm slowly breathing. I'll go ahead and start a timer now. You can leave your eyes open or closed, whatever feels natural, and just go ahead and focus on taking deep, slow breaths, drawing that air all the way down into our lungs, pushing that down into our belly. And as we exhale, feeling our belly rise as we fully empty our lungs. And just continue slow, deep breaths in and out. And notice, is your bottom hand moving? If it's not, try to focus in on that area. Okay, that was about a minute. You can go ahead and stop and just take a moment to check in with yourself. And how do you feel right now? So that is diaphragmatic breathing or deep belly breathing. Again, those slow, deep breaths, engaging those stomach muscles. On the inhale, the belly moves out. And as we exhale, the belly falls in. And you don't have to do this for 20 minutes a day to get the benefit from it. You can try it for 2 or 3 minutes at a time and even notice a difference still. And if you can do it 2 to 3 times a day, that's great. But if you can't, even just trying it once a day at the beginning will give you some benefits. Now, Julia is going to come in and talk about how stress affects our bodies.
Thank you, Michelle. Hi, everyone. I'm Julia, and I'm really excited to talk to you tonight about how our minds and bodies respond to stress. So like Michelle said, even though we can't get rid of stress, we can learn to manage it. And this in turn can impact our physiology or what's happening in our body. So I want to start by defining stress. There are so many variations of this definition out there, but for our purposes tonight, we're going to use this one. So stress is your mind and body's response and reaction to daily and life events. So these events are commonly called stressors and can be ones we typically think of as positive, like a wedding, or ones that are negative, like a cancer diagnosis. Regardless of the stressor, we have an automatic response that elicits certain changes in the body and brain. So we typically break down stressors into 2 categories, acute and chronic. So acute is short term, so it's time limited. So something like a traffic jam. Your body reacts, the stressor ends, and it goes back to baseline. Chronic or long-term stress is something with no perceived endpoint. So it could be a period of unemployment. It could be ongoing cancer-directed therapies, living in an unsafe neighborhood. Your body's reaction, this fight, flight, freeze response, which I'll talk about in a minute, stays turned on, and your body stays in this state of heightened awareness and reactivity. So you're basically ready to respond at any minute. So it's during these times of chronic stress that we really start to see changes in the body. And I would bet some of you have experienced some of these. So things like digestive issues, so indigestion or constipation, trouble sleeping, headaches, teeth grinding, and it can also impact us emotionally and cognitively. And Rochelle will be talking about this a little later. So most of the time, we can stay in this place where we're managing our stress, we're meeting our stressors, and they aren't overwhelming us. And we all have various ways of doing that. So working out, talking to a friend, binging Netflix, and we kind of are in this green and yellow zone. We also all have a tipping point where the demands of the stressor kind of outweigh our ability to cope. And that's when we start to tip into this orange and red area. At this point, we're doing whatever we can to survive the stressor. So like Amy was mentioning earlier, when I was putting this together, I immediately thought of the COVID pandemic and kind of the global stress, global chronic stress we've been under for the last 15 months. So when our brains and bodies tip over into this place of stress, it sets off a physiologic reaction that developed millennia ago to help our ancestors survive. So I would imagine most of you have heard of this fight, flight, freeze response. So this is our automatic response. Your sympathetic nervous system becomes activated and your body and brain enter this place. So when our ancestors met a saber-toothed tiger, they had to make snap-second decisions to survive. Do I fight? Do I run? Or do I freeze and hope it doesn't see me? So while your brain's analyzing these options, it's getting you ready to respond. So it's releasing a cascade of hormones like cortisol and adrenaline, and your body starts to change. So you shut down digestion and blood is being diverted away from the digestive system to bigger muscles like your arms and legs, and also to your heart. So your blood pressure goes up. And physically, you may start to feel some of these things. So your heart might start to race, you might be breathing a little bit quicker or holding your breath. You might feel sweaty or be getting kind of those clammy palms that we sometimes get when we're nervous. So all of these changes have adapted to give us our best shot at surviving. So I know we're not facing saber-toothed tigers anymore, but we do face a number of stressors. And how we perceive the stress, could this be a potential threat to my survival, leads our bodies and brains to react the way that it did thousands of years ago. Thankfully, we also evolved to be able to manage and adapt to stress. So during times when we're managing our stress, our brains are functioning in this top-down network. And that's this picture of the brain that you'll see on the left of the slide. And we're using our prefrontal cortex and our frontal lobe, so this blue and green area, to help us maintain attention and concentration. It lets us kind of adapt to situations, and it also helps with mood regulation. So I don't want you to worry about all of the abbreviations on the slides. They're all just different parts of this prefrontal cortex. So this prefrontal cortex also helps control the rest of the brain. So you'll see there the amygdala and the hypothalamus and the striatum. So when we're in this top-down network, we can think outside the box. We can problem solve. We can pay attention to our work or task for a while. And we can kind of see the humor in something that might have become frustrating a little bit easier. So during times when we're in chronic stress, when our fight, flight, freeze response is activated, we revert down to our bottom-up network. And that's the brain that you see on the bottom of the slide. And you can see that that kind of blue and green area has been grayed out. And now the amygdala in that red oval is kind of the boss of the operation. And so the amygdala is responsible for processing fear or anything threatening. So it also works in conjunction with that hypothalamus and the striatum. And you can see now the arrow is pointing up to that prefrontal cortex. So this is the main operation center now. This is also the area that sets off the stress cascade, and the adrenaline and cortisol is being released, and kind of all of those changes that we see in the body are happening. This is the part of the brain that's controlling that. So this is what I think is the coolest thing. We can bring ourselves out of this bottom network back into the top-down network by starting to recognize our individual signs of stress and using some of the mindfulness and relaxation techniques like the diaphragmatic breathing that you did with Michelle. So I mentioned those symptoms of chronic stress a little earlier, and I just wanted to put the slide back up to jog your memory. And so remember some of those stomach issues, indigestion or constipation. And so our blood is being diverted away from our digestive tract. Trouble sleeping. So remember, our body's in this state of heightened awareness. We're like ready to go at any minute. So those headaches, the teeth grinding from our muscles being so tense all the time, and a lessened ability to regulate mood. So remember that amygdala in the red oval has kind of taken over. By consciously being able to move and flip from the bottom up network to the top down network, away from this fight, flight, freeze, our bodies begin to have fewer and less intense symptoms. So also things like the cortisol and adrenaline begin to decrease, and we actually see an increase in something called oxytocin, which is this fabulous little hormone that causes this calming effect on the body. It also can increase the pain threshold, so we feel pain less intensely. And some studies have even shown that it can promote healing. So there are tons of benefits of relaxation and mindfulness. And as you can imagine, we're kind of the opposite of chronic stress and that fight, flight, freeze. So we see a decreased heart rate and blood pressure. And lots of studies have shown that even with the first few minutes of doing a mindfulness or relaxation response exercise, your blood pressure starts to drop. So even that minute with Michelle, my bet is a lot of people's blood pressure started to drop. So our muscles start to relax. We start to digest our food a little bit better. Our sleep gets better. And we feel this kind of general feeling of calmness. And that's kind of as we move from that bottom-up network to the top-down network. There have also even been studies to show that our bodies change at a cellular level, and it can help to prolong the life of certain cells. So I just wanted to give you kind of a broad overview. I hope this wasn't too much like a fire hose of information. I think the main thing I want you to take away tonight is that our bodies and brains do have that automatic response, the fight, flight, freeze. But by managing the stressors, by recognizing our signs of stress, we can actually start to change our physiology. So Michelle is going to lead you through another exercise now. So see what you notice happening in your body. Thank you, everyone.
Thanks, Julia. So this next relaxation exercise builds on our work with deep belly breathing that we just learned, but it's a bit more guided, a bit more directed, which for me, it helps me stay focused and in the moment a little more. It's called box breathing or square breathing. And it's another tool to reduce your stress by controlling your breath. So as you can see on the screen, we have a square with 4 even sides. And if you follow the moving ball around the square, you can see that it directs you to alternate breathing and holding your breath in even counts of 4. And I found this visual online. You can do searches for similar ones. We'll put it in our resources section at the end. But when you're learning to do different breathing techniques, I find little visuals like this to be really helpful to sort of learn the regulation of the timing and to keep things even and consistent. So as you can see, you inhale for 4 seconds, you hold for 4 seconds, you exhale slowly for 4 seconds, and you hold your breath again for 4 seconds, continuing again with the inhale. And you just repeat this cycle for 1 minute, 2 minutes, 3 minutes, whatever feels comfortable to you. And again, we're hoping to calm our bodies by controlling our breath, slowing down our heart rate, lowering our blood pressure, and regulating that autonomic nervous system, getting out of that fight or flight mode that Julia was talking about. So we'll give this a try together tonight for about 1 minute. I'll set a timer, and remembering to use those slow, deep belly breaths that we practiced earlier. You could even put your hand back on your belly if that's helpful for you to feel that movement. And as before, if you feel dizzy, simply stop or slow down or change your count to 2 or 3 seconds instead of counts of 4. So I'll go ahead and start the timer now, and we'll begin with the next inhale. Slow, deep inhale. Hold that breath and slow release. And holding again. Again, slow inhale. Holding that for a count of 4 and slowly exhaling. Some people like to breathe, inhale through the nose, exhale out the mouth, but whatever's comfortable for you to do those slow, deep belly breaths. And being sure to see if your belly is moving in and out with your breath. And we'll go ahead and stop with that. And you can just return to your natural breath. And again, take a moment to check in and see how you're feeling right now. So that's square breathing or box breathing. And we're trying to stimulate that relaxation response, trying to turn off that flight or fight response. And this is another exercise that you can try for a few minutes each day, or you can use it as needed if you find yourself in a stressful situation. I've had patients before who get nervous during MRIs, during scans, who've used this in the machine. They just envision the box and they've practiced and used the time breathing. But really, whatever works for you. All of the exercises tonight can be beneficial, whether you're able to develop a regular practice with them or just use them on an as needed basis. And now Rochelle will discuss how we recognize and view stress both individually and from a cancer perspective.
Thank you, Michelle. I want to remind everybody to please go ahead and put questions that you might have in the chat or in the Q&A as well as we go on. So there's a lot of attention on stress these days, right? We've all endured a lot of stress, varying types and levels during the pandemic. And many of us experienced headline stress disorder or engaged in a related activity, doom scrolling. And now we're all experiencing stress again as we're emerging out of the pandemic and getting back to our normal activities. On top of that, each of you have endured various types of stress as you've gone through your cancer experience. And you're likely continuing to experience stress, at least episodic cancer-related stress during survivorship. So far this evening, we have focused on how and why our bodies respond to stress. And you've experienced some of the benefits, I hope, of the relaxation that Michelle's been doing with us. So now I'd like us to think specifically more about developing your own awareness of your individual stress response and some of your stressors. So if we were to sift through all of the literature related to stress and its impact on animals and humans that's been studied, we really would break it down to this, that stress is this internal response to an external event. And if I were to ask you about your stress experience, you'd probably come up with either one or the other. This either or thinking about stress really makes us inclined to only focus on one. But really, for our maximum benefit, we want to think of this as a both and opportunity. So we want to think about our options. We want to think about how do we change the external event and how do we change our internal response. And as we consider these areas, I encourage you to think about this idea of perception. And so before we go on, I just want you to think, do you think about stress as being positive or do you think about stress as being negative? So generally stressors for us, these external events are pretty easy to identify, and Julia went through many of these already. These are some of the major life stressors that we're all familiar with. And when we look at these, some of these are perceived as being positive, and some of them we perceive as negative. Regardless of how we perceive them, they're all stressful for us. And so if we want to do anything about these, our first step is to really recognize these as stressful events. But I know most of us really don't want to see stress, right? We want to avoid it. And because stress is part of life, though, we're really better if we can become aware of it so that we can moderate its impact. So one of the first things we want to do is recognize stress. So just take a moment now and think, is there something stressful that's happening for you right now? Maybe something stressful you just went through, or maybe something that's stressful that's coming on the horizon. So if we go back to what Julia discussed, neuroscience research shows us that acknowledging that stress, the thing you just identified, moves the reactivity in our brain from those automatic centers to the more conscious and deliberate ones. So we're moving from that bottom up to that top down thinking. And when we are aware of these stress events, we can pause that reaction and create an opportunity to change our stress response. So some of you might be thinking, that seems really, possible, if I'm having an argument or in a relationship stressor, or if I've got a job loss, that seems more manageable. But cancer stress is different. So why don't we take a little bit of a look at the cancer stress? So these are some of the more common stressors within oncology care. And I'm sure you're all too familiar with them, and probably all of them. These are hard, right? I don't need to tell you that these are difficult. So when we think about when we're faced with these kinds of challenging stressors, how do we limit the impact on us? Thinking about our stress response as a helpful way to enhance our functioning in certain situations, like running from that saber-toothed tiger, that stress response is really helpful. But if we're able to do that, we can shift our focus away from the perceived negative experience and towards channeling or employing that response in a helpful way. So reframing your response opportunity as something beneficial can be helpful to you. So this concept of reframing is certainly more complex when dealing with cancer than if you're trying to take anxiety over an exam and turn that into an opportunity to improve your performance. The key here in our situation is to simply be open to the opportunity and the learning inherent in the stress. So let's pause for a moment for you to think about learning you've experienced through your cancer diagnosis. Just take a moment to reflect on your own learning. So here's a few of the things that people have told me. People have said that they've experienced deeper social connectedness, or they have heightened awareness. They've gained new perspectives. They have a greater appreciation for life. They have found or clarified a sense of meaning, and they've strengthened their priorities. And maybe some of those ring true for you as well. These examples show us that it's not the presence of stress, right? The individuals who shared these things with me had gone through a cancer experience themselves, but it's the perception and how they used it to alter its power. So let's shift from these external stressors and think a little bit now more about your internal response. So when we think about the internal response, Julia already shared some of these. We often first think about our physical experiences. And these top 5 are really the ones that are the most common for most of us. But sometimes we notice emotional impacts, such as these. And we might also notice an impact on our cognitive functioning. So as we think about all of these different types of reactions, and certainly there's many more, I want you to think of yourself as the expert in recognizing when you are experiencing them and when you're in a stress response. So think for a moment, what is your body's response? Think, what is your experience physically? What do you experience emotionally? And what do you experience cognitively? So now that I've reminded you what your stress response feels like, I want us to think a little bit about how our thinking impacts our stress response. So we talked about viewing that external stressor from a perception standpoint. Now we're going to take a look more at this internal response, because sometimes it's this perception that gets in our way. So many of us use something that's called negative automatic thought patterns. These are common ways of thinking that we all do. And I want to share a few of these with you tonight and provide some examples and see if they're familiar to you. So the first one is all or nothing thinking. In this situation, using this theme of stress awareness, you might start, if you're going to work on like your stress awareness after this evening, let's say you have a particular experience where you don't remember that you were in a stress response. If you were to use all or nothing thinking, you might say, I'm never going to be able to recognize a stressful situation. Overgeneralization is a common one as well. Again, using tonight's theme, you might say to yourself, you know, I couldn't do that one activity Michelle did, and so I'm never going to be able to relax again. Jumping to conclusions is something we often do, and we really break this down into two different areas. The first area is something we call mind reading. And into this one, we think we know what somebody else is thinking about us. So let's say you come into, pre-COVID that is, you come into the waiting room alone for a medical appointment. And when you're there, you notice somebody who looks over at you and you might say, I think they think I don't have any family or any support around me. That's a way of reading somebody's mind in a negative way. Another opportunity in this is fortune telling. And people predicting a medical outcome when there's no facts to support it is a perfect example of fortune telling. And I imagine you had some times during your treatment where this may have come up for you. And the last one are should statements. And in this, we really try to use should and shouldn't as motivators. So maybe tonight you'll say, or tomorrow you'll say, I should do that relaxation breathing Michelle taught me. So these are all really common things, and we do them in everyday life. And sometimes we do them in ways that are really unhelpful to us. And they can actually increase our stress if we use these approaches. So what do you think? Did you recognize any of those? So when people are thinking about what am I going to do about my stress and may come and talk to myself or maybe Dr. Bullis, we usually think about one of the most research supported treatments, which is called cognitive behavioral therapy. And at the root of this approach is understanding that our thoughts influence our emotions, and in turn, those influence our behaviors. And so becoming aware of when we use these types of unhelpful thought patterns on this screen is our first step to change them. And when we work to reframe our thoughts around situations, we can reduce our feelings of stress. So if you notice yourself using one of these automatic thought patterns, stop and recognize it. And give yourself an opportunity to find a different way of thinking, and you'll likely follow that your emotions will follow and that your stress will change. So hopefully tonight, we've moved you a little bit from some of that scramble you might be feeling to some opportunities and experiences that we might be able to take with you. We're going to do one more opportunity later on for relaxation, but first we want to go ahead and move into some questions. So again, if you have any questions, please feel free to add them into the chat. And we hope that tonight that you learn a little bit about stress impact on our bodies, ways that you can identify your stressors, and some of the opportunities and techniques to manage your stress level. And as we move into questions, we do want to just put up a resource slide. These are some different apps and things to search if you're looking for a little bit more information. Thank you.
Thank you so much. That was such a fascinating presentation. We learned so much from all three of you. I already see one question in the box, and this question is for Michelle. So when you were showing that slide for the box breathing, Our participant was wondering if you recommend breathing in through your nose and exhaling through your mouth. If you could be a little bit more specific and clarify that. Thanks.
Sure. I think some people find that by breathing in through the nose and out through the mouth, it helps to slow their breath even more. And it gives you sort of another point of focus. And some of these exercises, we're focusing on our breath in an effort to help block out things that may be going on in the outside world. And so sometimes bringing in a few more cues like that, in through the nose, out through the mouth, following the box, things like that can just sort of help you stay in the present moment, and sort of pinpoint your focus on that.
Thanks, Michelle. Rochelle, you mentioned scan anxiety, which is something we all hear about a lot, especially in the survivorship phase where there's still scans or regular checks. And I'm wondering if you could talk about some of those cognitive pieces, like how you help people work through that when they're anticipating that coming up as a stressor.
Yeah, sure. One of the things that I've learned is this term scanxiety, which I kind of love that term, and it's also kind of a terrifying term, I think. One of the things I really encourage people to do is to think about and compare these facts versus emotions. So oftentimes what we know is what our last scan was, or that we've done everything we possibly can to go through our treatment, and that these are some of the facts we know. We also have a sense of confidence usually too within our medical team that regardless of what comes up in this scan, that we have a team that's been with us and is going to support us and we're going to move forward. So even though there is some uncertainty, if we can focus in on what we do know and hold on to those rather than the fear and worry as the thing that we see as the truth and the fact, and to be able to recognize that that's an emotion, not a fact, then we're able to bear that a little bit more. I think I always encourage people to bring in a relaxation technique with them, because that oftentimes only goes so far with people, and really being able to do something like Michelle said with the breath and something that's a little bit more guided and focused is something I usually encourage people to do as well. So they've got a couple tricks up their sleeve.
Great. It looks like there's a question for you, Rochelle, in the chat box. Is the fortune-telling response directly correlated with the occasional overwhelming fear that cancer will return, or is there another name for that type of thinking?
Great question. So, we commonly call that fear of cancer recurrence. I think there's sort of a portion of fortune telling in that, in that sense that, as Jennifer was just asking, a lot of times that's rooted more in fear or a perception and is not rooted so much in the facts that we know or the statistics that we've been given. So I think there's a component of it, but it isn't the sum total of all of it.
I'm going to stop sharing my screen in a second so that you can see the speakers a little better, but I just want to remind people, if they want to take their phone and take a quick screenshot of the resources, I'll leave it up for about another 30 seconds if anybody wants to do that.
Thanks, Michelle. I thought we had another question coming, but maybe it's still on its way. Julia, you talked a lot about this sort of top down and then the bottom up, that sort of takeover that happens. And I'm wondering if you would, sorry, I'm reading the other half of the question. I'm gonna save it for Amy. Could you talk about that a little bit? Because I think sometimes, right, I loved those colors where people are, if you're hitting that orange and that red, how do you pull that top down back online to get you back over into those other nicer colors?
Sure. So I think, thank you, Jennifer. I think part of it is starting to recognize our stress symptoms, like Rochelle was talking about, what's happening physically and emotionally and cognitively. And as we start to become more aware of those, we can catch ourselves. And so as we're kind of moving out of that top-down network and from that blue and green part of the front part of the brain, we can catch ourselves from going back into the bottom-up network. And sometimes just through a few deep breaths, 30 seconds of deep breathing can help us from tipping over into that orange and red place on that other slide. So I think everybody tends to find ways to manage stress with mindfulness and relaxation that they like. Diaphragmatic breathing, the following the ball, that can help us stay in that top-down network. And if we do slide into that bottom-up network, I think, you know, we have ways to manage it, and choosing one that you like and that kind of speaks to you and resonates to you can help you flip back to that top-down network. And I think what's so fabulous about it is that we can start to manage it and have some control over this seemingly uncontrollable thing that happens to our body.
That's great. Thank you for that great explanation. There's one last question, and then I know we're going to move on to our relaxation exercise with Michelle. And it's just really getting back at that issue regarding the fear of recurrence, which, as we know, is very prevalent amongst our patients. So our participant has stated that it seems that people, both in the medical field and lay people who mean well, often will dismiss that fear as being unfounded. If you had an early stage cancer, and this participant is saying that she thinks that that should not matter. And what are your comments about how one handles that?
Yeah, I can just speak to that for a moment. You know, I think I appreciate you bringing that up, because this is something that patients share with me a lot, in particular when they finish their treatment. And it's often people who were diagnosed with an earlier stage cancer diagnosis who will come in and say they don't feel like the worry that they're having is equal to what their cancer diagnosis was. And they really wonder, is there something wrong with what's going on for me and how I'm coping? And I don't think there's really, that I'm aware of, any research that correlates our worry or our fear of recurrence with what your diagnosis was. And what I usually, encourage people to do and to think about is, as we talked a little bit about tonight, like, what are those stress responses for you? For some people, they're a lot easier to trigger than others. And to also, I always ask people the question, what's cancer mean to you? Because for many people, regardless of diagnosis or stage, cancer is terrifying, right? And so if that word evokes that kind of terror or worry in you, it doesn't matter what your stage is, that's your own internal experience. And that we want to address what your own internal experience is, not what anybody else's is or what anybody else's perception is. That's the way we usually work with people on that.
Michelle, I'll turn it over to you.
Great. Well, we hope you enjoyed your evening tonight. Thank you again for joining us. And we'll end tonight with one final exercise. We're going to do a body scan with some self-massage. If focusing on your breath isn't for you, some people can't sit still. And in fact, sitting still and thinking about their breath causes more anxiety. This exercise might resonate with you. It involves a little more activity. And a body scan is a relaxation technique that asks us to become aware and notice different parts of our body one at a time. And for our body scan, we are also going to bring in the added element of touch, so we can benefit from that soothing and calming nature as well. Because calming and soothing touch can have profound effects on the body and the mind. Think about our natural intuition with babies. If they're fussy, we gently rub their back. Or if our cats or dogs are feeling a little wild, we do some gentle stroking, some gentle petting. And that touch works whether it comes from someone else or from your own two hands. So that's what we're going to do now. It'll take about 9 or 10 minutes. We may go over by a minute or two. I hope that's okay. I'll list different parts of the body. And when I do, you'll go to that area and just apply some gentle massage in that area. It can be just some gentle stroking, like you're applying lotion, maybe some gentle squeezes, even some light scratching, whatever really feels good to you, whatever feels natural. You can also just keep your hands still and just feel the heat and the pressure from your hands. You don't have to work super hard here, just whatever feels right. And we're going to move from our head all the way down to our toes. So I'll give you a moment to go ahead and find a comfortable position in your chair. Just shift a little bit so that you feel like you're not holding your body. As you do that, I'm just going to move so you can see me a little bit better. And you can leave your eyes open, you can close them, or just pick a spot in the room to soften your gaze, whatever feels comfortable. Feeling your feet flat on the floor, letting your spine be long and tall with your chest open. Allow your shoulders to drop. And you can let your arms just rest gently in your lap right now. And begin with 2 or 3 of those deep belly breaths, drawing the air in, and just feel the weight of your body in the chair. Feel the chair beneath you supporting you. And just continue to focus on that breath. In and out. Those slow, deep breaths. And as you do, begin to notice any sensations you feel in your body as you breathe. And now bring your attention to your head, to the top of your head, to the sides of your head, and the back of your head. And you can just begin with some gentle, slow strokes. And as you do this, just feel the sensations under your fingers. Maybe move to the base of your head, right where it meets the neck. Do some circles here. Just some slow movements, nice and gentle. Whatever feels nice. And now we'll move into the face and bring your hands to your temples. Again, you can do some gentle circles here, some strokes down. You can follow with what I'm saying or just do your own movements down into the jaw. Let your jaw open slightly. Let those muscles let go. And maybe some long strokes down through the chin. Just allowing your fingers to follow the contours of your face down into the neck. And maybe some gentle squeezes. Bringing your hands, your fingers through the tissues here, from the back to the front. As you move down your neck, Again, if you find a place that's calling out to you, you can hang out there a bit longer. And down into your shoulders. If your arms are getting tired, you can switch and just use one. You can do some stroking. Maybe some squeezes. Down throughout my shoulder. The other side as well. This is where a lot of us tend to feel pretty tense by 8 p.m. at night. Now we'll move into one of your arms and just do some nice long strokes, nice and slow. Just feeling the whole length and the breadth of your arm. Moving down into the forearm. Maybe some squeezes here or some light scratching. And down into your hand. Making sure to give some attention to the palm of the hand. Maybe a light squeeze to each finger. And press that space in between your thumb and your index finger. That usually feels good. Into the other arm. Giving some attention to the upper arm, the lower arm. And you can even close your eyes now and then to just feel. And down back in through the hand again. And we'll press on that space in between the thumb and the finger. And now down into the low back. If you can reach your low back, just some slow circles here. You don't have to use much pressure, just the pressure of your hands. If you can't reach your low back, you can move into the belly. You can do some clockwise circles, working with your digestion, or just some still hands. Your hands are probably pretty warm by now. You can feel the heat coming from them. Now we'll move to the upper legs and we can do some long strokes here. We can even do some gentle punches here, nothing hard, just giving some attention. Again, whatever feels good to you. Make sure to get the other leg too. Maybe some gentle squeezes. And now if you can, bring one leg up, put your ankle on top of your other knee like this, and you can gently work the calf, your lower leg. You can alternate hands. Moving down into the foot. Maybe some gentle squeezes through there. And then switch and bring your other leg up. And again, giving some attention to the lower leg. Just letting my hands follow the shape of my body, and just wherever they want to go. And then down into the foot again. And then you can just place both feet back on the floor and just sit for a moment and return to your breath and tune into your body. And now feel your whole body, your entire body as one. And now go ahead and take 2 or 3 of those deep belly breaths, those cleansing breaths, filling your body with air. And when you're ready, you can slowly open your eyes. You can shake out your arms and legs a little bit and return to the present moment in our call tonight. And go ahead and offer a silent thank you to yourself and to your own 2 hands. We thank you for coming tonight, and we hope you have a restful evening.